Hello and welcome to this compact medication review, where I try to condense all valuable information into a short and precise presentation. I will include timestamps below so you can skip right to the part you find most interesting. My name is Jordan, and today we're going to go over a relatively unknown drug called tianeptine. Before we start, this video was created for the purpose of providing information and harm reduction, meaning the content of this video is purely informational and is not intended to substitute a consultation with a medical professional. Do not take tianeptine or any other medication without consulting your doctor, even if you are experiencing symptoms the medication is intended to treat. So, what is tianeptine? Tianeptine is an atypical antidepressant, meaning it does not act in a way traditional antidepressants would. It is neither an SSRI, meaning it does not increase the available level of serotonin in the brain, nor a traditional tricyclic antidepressant. Tianeptine is an agonist of the mu opioid receptor, meaning it activates one of the main opiate receptors in the brain. Analgesia, sedation, euphoria, itching, and decreased respiration are typical effects of this receptor being activated. Anxiolytic effects are also present, though it is still unknown which exact mechanism these attribute to. In general, there seems to be a lot of unknown when it comes to this medication and how it really works. Tianeptine is available as either tianeptine sulfate or tianeptine sodium. The sodium version is used in medicine, and these uses are treating depression, suppressing anxiety, treating asthma, and treating IBS, irritable bowel syndrome. In some countries, it is not a regulated medication, like the US. There, the less active sulfate version is available as a supplement. Tianeptine comes in 12.5 mg tablets, which are to be taken at morning, lunch, and noon. For the first week, only morning and noon, to get used to the medication. The maximum amount of tianeptine per day is 37.5 mg, which should not be increased unless instructed to do so by a doctor. You are able to take tianeptine without food. Do not take tianeptine if you've ever had anorexia or any other form of eating disorder. Also, no changes in dose should be undertaken without a consultation. This is especially important when reducing the dose, due to abruptly stopping the medication will likely result in withdrawal symptoms. If you forget to take the medication, just wait until it's time for your next dose. Do not take 2 tablets within a short period of time. Now to the side effects. Roughly 1 in 10 patients experience anorexia, insomnia, nightmares, headaches, dizziness, drowsiness, heart palpitations, muscle and chest pain, difficulty breathing, and diarrhea. Roughly 1 in 100 patients experience addiction and skin irritations. An unknown probability of side effects are low blood sodium levels and suicidal thoughts and tendencies. Compared to SSRIs, tianeptine does not cause tiredness and sexual problems. For patients who have experienced extreme side effects with typical antidepressants, tianeptine might be worth a shot. Taking large doses of tianeptine will result in increased side effects and will produce an opiate-like high. Combining above therapeutic doses with other substances makes it drastically more dangerous and has resulted in deaths in the past. Also, do not combine the medication with monoamine oxidase inhibitors. Wait 2 weeks after last dose before starting treatment with tianeptine. On the other hand, if you were treated with tianeptine and are switching to an MAOI, 24 hours should be sufficient. But of course, always consult your doctor. Okay, now to my personal experience. I found it to be less effective than citalopram, a common SSRI. The overall well-being citalopram provided me with is something that tianeptine lacks. I was also surprised to experience almost no side effects. Negative thoughts were less present, but there was definitely no sedating effect. After a while, I noticed a dependence creeping in. Getting up and ready in the morning got a little bit harder without the morning dose. I could compare it to skipping a cup of coffee in the morning. I feel like my trail of thought has changed since I started the medication, but it's hardly noticeable. Not forgetting a tablet in the morning can be tricky sometimes. Now taking 3 a day really starts to be challenging, especially the dose around lunchtime, due to me rarely being home. I hope I could provide you with a little bit of insight. If you have any questions or feedback, please leave them in the comments. I would also greatly appreciate a subscription. It really helps me grow this channel. Thank you for listening.